what are the most popular misconceptions parents have about infant sleep?
I think one of the biggest misconception out there is that we need to teach sleep to children, or that when sleep doesn't go well, that we haven't taught them, and that is why it doesn't go well. I believe that it has to do with our culture. If you go to different parts of the world, you might not have the same answer. We know that non-Western societies view solitary sleep and teaching babies to sleep alone as something that is completely outside of them. It doesn't align with their values, and they might even look at it as cruel. But in Western societies, we view it as normal and as something that is expected for parents to do.
That's interesting that you said, because both of us live more in a Western society, and I've heard a lot as a parent when I used to have a small child, like there are different types of sleep trainings. So what are the most common and what are the pros and cons?
Okay, well, the most common ones, let's just call them, in the literature, they're behavioral interventions. So what you have is that researchers and maybe society at large see infant wakings as a behavior that needs to be solved. In the holistic sleep coaching world, we look at it as our babies calling us for help to help them go back to sleep. But many times in literature, you will see them as a problem and something that needs to be solved. So the behavioral interventions we have are extinction, which is cried out, most commonly known. Then there's the modified extinction, which is the controlled crying, and this is because many parents find cried out very difficult to implement. They might choose the controlled crying,
which is what?
The most common ones. Yes, I'm going to say what these are. So the cried out is you do the whole sleep routine and some steps before putting them to their crib, and once you've done that, you put them to the crib, you turn off the light, you say good night, and you leave the room till the morning. So that's why parents find it difficult to do that, because it involves a lot of crying and it's very hard. And then you have the modified extinction, controlled crying, which is you do your sleep routine, you put your child to bed, you say good night, you leave, and then you come back. And how often and for how long you will come back, it depends on the method. But usually you have something like you wait for 5 minutes and you go back in, then you go again outside, you say goodnight, you go outside, then you go back in, and you're checking the child. This also involves quite a lot of crying. So there you have it. And because you asked me this question on our email, I Googled to see what comes up as benefits of these methods, or what might parents find if they're Googling this. And what you usually find is that they're fast, you get fast results, and they're mentioned to be effective in reducing sleep wakings. So there you have maybe these two pros.
What are the cons of this approach from your perspective?
Yeah, the cons of this approach, and why many of us are not using sleep training methods, I don't use these methods, for example, is that there is research discussing the effects of toxic stress on children, especially in the first 3 years of their lives, when neurons are being formed and you're setting up all habits for lifelong health. So there is a question there whether some of these methods can cause toxic stress to the children. We also have one research by Middlemiss. It's very often cited if you see the critiques about these methods, where we had 4-month-olds, and this happened in a sleep school in Australia. They had mothers come with their babies, and they did a sort of a controlled crying intervention. what we saw was that when they measured the stress levels of the babies and the mothers, when the babies were crying, the stress levels of the mothers were high, and the stress levels of the babies were high as well. And after the intervention, the baby stopped crying, but the stress levels remained high, and the mother's stress levels were low. This research shows us that perhaps the caregivers are not attuned to their babies anymore if they follow some of these or a variation of these methods. On the contrary, this study has also been critiqued about happening at home and not having the stress levels before they went in. So you shouldn't take it as the definite answer, but it definitely puts some question mark there, and it makes me think that we need more studies to know whether it is that the caregivers think their babies are sleeping and they're not stressed anymore, so they feel like this worked. I can give you a few more cons that I have looked in the literature. So one is that the parents themselves often find these methods stressful, and they might stop using them. I will give you the citations. That's Lutzen Hieser, I think it's called, her name is, 2012. And we also have another study by Tse and Hall in 2007 that it said perhaps these methods work, or actually they saw that these methods work better in research settings than they work at home. At home, we have seen parents taking maybe even 30 days to implement this. And actually this was this year with the NANIT study. It was again seen in a study that was made by a company called NANIT, who sells baby monitors. And they said sleep training works, and it was all over the media. But when you look at the paper, it looks like these interventions, extinction in particular, might take 3 to 25 days to work. So again, we see the same.
That's a lot of time.
The last one I can share with you is a systematic review and a meta-analysis in 2021, Van Gappel and al. I actually love this paper because it was made by sleep scientists, so they're usually like more biased to think that sleep training works. And their question was, do sleep interventions change sleep duration in children aged 0 to 5 years? So do they sleep more? Do they sleep longer? And the results was that there was very minimal increase. It's not statistical significant. It's not even something that we would feel good to hear about, because they found that in a whole 24-hour period, the sleep was increased by 8.6 minutes. Nothing. And the nighttime sleep was 9 minutes longer, daytime sleep 2.5 minutes longer. That's peanuts, I would say.
Yeah.
So I have to put this in the cons, because we think that it works and it's fast and it's just a few steps that parents need to take. But the research slowly shows us that this might not be the case.
When we talk about this behavioral type of trainings, this is one, let's say, approach. When there is an approach like you do the routine, you put the baby into crib and you stay with the baby, let's say, but the baby might cry, etc., but you don't sort of take it and you don't hold it, you just try to keep him or her in the crib. Is it the same variation of behavioral training?
This is what you're referring to is camp it out, we call it, because they stay close to the baby. And there are also two variations. One is that you don't pick up the baby and you stay on their side. The other variation is that you pick them up when they're crying and you put them down again. And it's considered to be in the middle, because you have the behavioral interventions with extinction, where you're just making this separation between parents and infants. Then you have the no cry. So this is somewhere in between. I would say it depends on the age of the child. I mean, you might be able to do that with a toddler, that they have object permanence and they know that you will come back. But with young babies, it can also be stressful. So this is something I would definitely have to know, temperament, age, what is happening, how are they used to being taken care of before. And from the research, it is usually looked together with extinction methods, I have to say. They're not in the, what do you call them, the interventions that are alternative.
Okay, so if we will talk about alternatives, what are the alternatives to any type of, let's say, behavioral approach to the sleep? What else?
You have the no cry, which I think we also need to define, because many parents feel like the no cry means you will have to respond on every small noise you hear, and there's no room for change. You have to co-sleep, usually, and maybe nurse to sleep, or feed to sleep, or rock to sleep. And many times they reject that because they're exhausted. But actually the alternatives are not just that. You have sleep saving, where you can look at sleep and make the child's sleep hygiene better. So you can look at factors like taking them out to the sunlight, waking them up at the same time every day, to help their circadian rhythm align with your schedule and feel sleepy at night. You would also try to eliminate any screens they have before bed, feed them regularly in the day so that they don't reverse cycle into the night, offer connection during the day so that they, like some of us call this a small cup inside your baby that you fill with quality time and love and connection. And then if you fill it in the day, then you don't need to fill it at night. And then you have other alternatives. If these things don't work and one parent has a lot on their plate, you can think of having another parent coming in and responding to the child. You could make changes, like maybe bed sharing is not something you want to do, and you want to go to co-sleeping in the same room, or you want to go to bring your child to another room. Like there's also room for all this stuff. And you can also change the way you're responding. So instead of say nursing to sleep, you could choose rocking, or you could choose giving hugs and stroking your child, so that they patting your child so they feel better, and they can relax. So yeah, you have different ways you can try, and usually what happens with these alternatives is you tailor them to the child and to the family. So you would have to take into account what caregivers want to do, what they find nice, and what they feel good about. And with the behavioral interventions, usually you choose one and it's the same for every child. It doesn't have large variations for all these things.